All right, welcome back. This is again my lovely assistant Evan, and this is a follow-up to the earlier treatment where we used manual therapy to treat his peroneal nerve tension in his leg. So we treated that with hands-on. Now we're going to do an exercise to both floss the nerve and put his lumbar spine in a position based on how he moves. So when Evan moves cardinal plane movements, when he side bent to the left, he had a real nice, good-looking C curve. When he side bent to the left, he got very little movement from his lumbar spine in right side bending. So what we're going to do, we're going to put him on his right side. We're going to put this under your waist. So pick your waist up. Good. A little bit more. There you go. Right there. Good. And then we're going to scoot you forward towards the edge of the table. And then we're going to let the legs hang off. Good. So all this is doing, this is inducing a nice little side bend in his lumbar spine. Michael Shacklock, he's a physical therapist from Australia. He wrote a book called Clinical Neurodynamics. This intervention is in there for treatment of lower quadrant nerve issues. It's a really great book. A lot of really good stuff in there from treating neurodynamics with manual therapy exercise. So he calls this would be a level 2 opener. Evan's pretty low irritability. Level 1 opener would just be sitting like that with a pillow, creating a little natural lumbar spine, lumbar side bend. When we lower the legs off the table, it's a little bit more aggressive. And then what we can do here, we can have Evan do with just the top leg. Evan, you're going to kick, and then you're going to point your toes down to the floor. There you go. Good. And then back up. Good, so that would be kind of a slump motion, and I'll change the camera angle so y'all can see exactly what he's doing with his feet. So he kicks and then points his toe down to the floor. So he's doing a peroneal nerve slump in the side lying position with the back in an open position. So we already know that he kind of fits into a flexion category because of his positive spurlings for extension and rotation. So we want to put his back into a flex position and then have him floss the nerve. How's that feel, Evan?
Feels pretty good.
Good. All right. So, and then what we could do, we didn't check beforehand, but he would go through maybe a couple sets of 10 of that, maybe 3 sets of 10, whatever he can tolerate. We want to make sure that he does feel the symptom a little bit in his leg when he does it, and that he is kind of getting a little bit of flexion in his lumbar spine unilaterally. And then what we would do is, Evan, go ahead and lay on your back. Then we'd check like we did the first time, and we would just compare it. So we'd bring him up and just kind of get a question, when do you feel it? Anything at all?
No.
What about here?
No.
Okay, so that's what we'd want to compare it to. That would be, we'd do a test and post-test. We check before the intervention, after the intervention. But that would be an example of an exercise of what he could do to manage that after we treated it manually.